Good morning, everybody. Good to have you along with us. Dr. Stephen Mulholland is here. Thanks for coming by.
Thank you.
We love when you come and do this. Good morning. We haven't even had a chance to meet yet. What's your name?
Sue.
Sue. Good to have you here, Sue. Now, explain a little bit what's going to be happening live on the show in the next 45 minutes or so.
We're going to show your viewers the newest and greatest of the immediate injectable fillers. So we're going to build Sue a chin in about 60 seconds.
Unbelievable.
A 60-second chin lift.
That's really what people are looking for now, isn't it? The fact that you can go in, you can have something done fast, and how long will her recovery be?
Her recovery will be looking good tomorrow.
Tomorrow. So you just got back from Asia?
Yeah, I was in Japan, Korea, and Singapore, just teaching doctors what we do in North America here to help people look their best and hopefully feel their best.
A lot of stuff is always being developed. It's amazing. So that's partly what you're finding out there as well, right? Is there one thing that kind of grabbed you that's the latest, hottest?
Well, interestingly, here in North America, we lead on the technology sector, and they're fascinated in Asia by the ability to change and maintain shape. And they usually have nice prominent cheekbones and chins, and so these new families of injectable fillers are probably the hottest new thing out there.
Fantastic. So this is your OR. This is it right here.
This is it, the BTOR.
The BTOR. Okay, I'll leave you to it to get prepped. Thanks for coming today, Sue, and we'll talk in a little bit. Dr. Stephen Mulholland from SpaMedica. 7:52. Hello, everybody. Dr. Stephen Mulholland is here with us, cosmetic and plastic surgeon and surgical director for SpaMedica. Great to see you.
Good to see you again, Liza.
It's been a while. So we're going to be showing you actually a live. What do you call it exactly?
I call this procedure the Voluma lift. It's an injectable facelift in essence, and it uses products that are available in gel form to build up those areas of the face where we deflate.
Which we all go through.
Absolutely. It's like air out of a balloon. You know, as you get older,
it
just sinks in. And it's not always the right thing aesthetically to lift without adding that volume to the central part of the face.
So Dr. Mulholland's going to do that live in just a couple of minutes, but we want to talk also about some new things that are coming down the pike. A photo firm, is this like a photo facial?
It's similar, we're now about 6-7 years into the photofacial procedure, which is, there's probably 20,000 photofacials done every day in North America now. And what we, in addition to red and brown discoloration improvements, we like to tighten and firm, and there's some new heads out, some new applicators that are used during that photofacial to tighten your skin. So we bring back volume with the new product like this Restylane Sub-Q today, and then we can also do a photo firm photofacial to tighten. So we can tighten and bring back volume without using a knife.
So you're not getting a facelift result because that's dramatic, but you are definitely, so who would it be right for?
It's right for people that that pass what I call the distraction test. If you can grab your jowl and you pull and you can't see your earlobes anymore and it just keeps going, you know, we can't do anything non-surgical. You really, that's a 911 scalpel emergency. But if you just have an inch or two of loose skin and you just want to look your best and you don't want a lot of risk or downtime, then a photo firm, a volume lift, things like that are simple.
Listen, I've tried those photofacials. I miss them. I like them. It's very subtle. It's not something that people just think, oh, you look kind of fresh.
Well, next to our kids, our skin is our most valuable possession. And you want to look after it and protect it, and photofacial, photo firm's a good way to do that.
So let's talk also, it's summer now, so people are thinking about hair removal. There's something called the Comet?
Yeah, the Comet's an interesting device. It combines our traditional laser energy with electrical current. So you get almost like pulsed electrolysis and laser hair removal all in one treatment. So it's good if you have tanned skin. It's good if you have gray, blonde, or red hair, which traditionally we haven't been able to treat. And it just doubles your chances of getting some permanent reduction for your hair because you have the electricity part and you have the laser part.
Oh, okay. So it should give you not necessarily a speedier result, but a longer result?
And usually a more effective result,
Okay, and this should last for life.
Well, if you kill the hair, it's dead, exactly. Yeah, so on average, 50 to 75% of the hair, if you're white skin, dark hair, will not come back.
Okay, and that's all due to the big pigmentation. You need that sort of pigmentation. Lipo-Lite.
That's going into be, again, a huge procedure, non-surgical liposuction, essentially, contouring fat where you don't want it.
Does this really get rid of cellulite? Because there's been so many things out there, and it's like the bane of women's existence.
It's good for cellulite, but not great. It'll smoothen your skin.
Okay.
But what it's really good at is melting your fat. And some women come in and say, I don't like my cellulite, but what they're grabbing is a great big chunk of fat. Cellulite is that lumpy, bumpy skin.
Yep.
Fat is the wiggly, jiggly stuff under it.
Yeah.
And it's good at removing the fat.
Okay, so you're going to lose inches and have some smoothing.
Without liposuction, without surgery.
Okay, let's go walk over and meet Sue, and you can explain exactly what you're going to be doing today. Sue, you're a champion, by the way. I so respect people who come in and are willing to do this on TV, so thank you for that.
Well, Sue has always complained of having a little bit of a weak profile. If you look at her side view, she lacks the projection to balance what is a strong nose, very attractive cheek, and an eyebrow structure. So there's a new product that's called Restylane Sub-Q, which generally lasts about 18 to 24 months. And so it fits that nice niche where people want to try on a new shape. They're not sure they want to do something permanent.
Right.
But doing it every 3 months is annoying.
Right.
And that's where this new Restylane Sub-Q is nice for building up chins and cheeks and contours and letting people try it on, see if they like it before doing something permanent or repeating.
Oh, okay. So this wouldn't last forever necessarily?
It lasts about 18 to 24 months. And you get to try on your cheek and your chin and say, yeah, I really like that. And either do it once every 2 years or move into something more permanent.
Okay. I'm going to grab that microphone from you for a sec, Jess, and talk to Sue. So is this something that has bothered you just in the short term, in the long term?
Probably in the long term.
Is that right?
Yeah.
So it's just something where you feel like you look in the mirror and you wouldn't mind a little change. How are you feeling right now? A little anxious?
Frozen.
Very frozen, yeah. If Sue seems like she's talking like she just came from the dentist. She's already been frozen.
I put her freezing in, yeah.
Okay, so she's all ready to go. It's very exciting, though.
It is.
Okay, and then you think that how long will Sue need for recovery?
It takes me about 5 or 6 minutes to do the procedure, and then the only unknown is where there'll be some bruising. So I always tell people anticipate the worst and hope for the best. So she may have a little bruising, discoloration around her chin. It's always good to blame things on the dentist. So just say I had some dental work or I had some gum work, and that will get you by.
If you don't want to, yeah, because it's it's your business, or you do it on TV and you don't have to worry about that at all. Dr. Stephen Mulholland from SpaMedica, he's going to do that procedure on Sue right now, and we will see the final result before the end of the show. Thank you. We'll take a break. We'll be right back. All right, lady. Going to caller number 7 who can tell us what is Dr. Stephen Mulholland creating right now live on our show. He is actually doing a procedure for us. The patient is Sue, and we're going to check in with him again in a couple minutes and watch him do this procedure, but we were explaining it. What's he doing? 416-870-7716. Seventh caller to get it right will win. We'll be back with a look in just a second. We're back with Dr. Stephen Mulholland from SpaMedica and our patient Sue, and that really was phenomenally fast. For people just joining us, tell them what you just did.
Well, I'd already pre-frozen the lower part of her chin. I took this new product, this Restylane Sub-Q, and created what I call a volume lift to her neck and chin to create a new jawline. And if we just turn her sideways, because that's the real interesting shot, we'll turn her sideways here, and you can see the difference between her before and after on her profile.
So let's bring up that before, and we're seeing now, and this was like 5 minutes that this happened.
It took about 6 minutes to do a side.
Oh, we'll bring her back forward, just as we bring up the before. There we go. Okay, and then we're going to bring up her picture. And then we're going to get you a mirror, Sue, so you can see this yourself. Okay, so there's Sue before. Wow.
And then after her volume
and then
lift
there
and
is the after.
Nice for a 6-minute procedure.
Oh my goodness. All right, let me grab this mirror, because you must be anxious, Sue. If you want to take a look, here you go. Tell us what you think. Go ahead.
Oh my goodness. That's awesome.
Isn't that something?
It definitely is.
Really, it kind of
We should show her profile shot, because that's how patients present. They say, I really don't like my profile.
Yeah.
And do you want me to turn her?
I think we have that profile picture. Yeah, we'll go ahead and we're going to give you a little spin again, Sue. Let's take a look. There's the profile picture. My
So no
goodness.
chin, no projection, no balance. And
then now we take a look at in 6 minutes.
under local, right in your chair here.
In the BTOR. Okay, so tell me, as you were going through it, obviously there's nerves for anything like this, but what were you feeling? Anything?
Nothing.
Nothing at all.
No.
And that's just a local freezing like you get at the dentist?
Like a dental type of freezing, it'll last about 90 minutes like this. And all of my Volumilifts, when I'm injecting whatever product, Restylane, Sub-Q or whatever, I do it under local, so people don't have the nausea and the risk and they can get up and go right home. She may have a little bit of bruising, but she'll be back to work tomorrow to tell her story.
Is this what you expected? Is this what you were hoping for?
Absolutely, yeah.
This
it
end
looks
result?
fabulous.
It really does, Sue. And then now Sue can make the decision whether she wants to maintain this
Yep.
or move to something more permanent.
Yeah, we're lucky in Canada. We have a lot of filler options, and as we age and lose that nice facial fat, we can use a product like this one. The Sub-Q lasts about 18 to 24 months. You may come back and say, I love it, but is there something I can put in last years, or just do this every 2 years?
And what would last years?
Your own fat or something called the bioalchemid, which is another gel, but it's formulated to form a little capsule around it, and it becomes your chin or your cheek or your nose.
Right, so this sort of filling that you've used today could be used if you start to lose volume
Yeah,
here.
very common. So when I do a Volumilift, I basically inject above the eye, under the eye, across the cheeks, around the mouth, jawline, lips, and sometimes even the bridge of the nose.
What kind of price are people looking at generally?
For the long-term, last my whole life product's around $5,000,
Yeah.
and for a temporary product like this, it's usually around $2,500.
Do you feel like it was worth it?
Absolutely.
Way to go, Sue.
Thank you
Thanks for
very
being
much.
so brave. Dr. Stephen Mulholland from SpaMedica, and you can go to SpaMedica.com for more information on all of their services. We'll hook you up with that through the BT hotline and website as well. Thank you.
Thank you, Liza.
Thank you both for being here.